I now recognize Chairman Smith for questions.
Thank you, Chairman Buchanan. When 54% of Medicare beneficiaries are choosing a Medicare Advantage plan, there is clearly a strong and growing interest by seniors to have access to MA and the benefits that come with it, like lower out-of-pocket cost, access to supplemental benefits such as prescription drug coverage and transportation services, as well as specialized plans tailored to patients with chronic conditions. Patient enthusiasm for the program is exactly why we should ensure its integrity. For example, we know of concerns about MA plans inflating a patient's level of sickness, resulting in higher reimbursements for the plan at taxpayer expense, and an estimated $40 billion in 2025 alone. Ms. Maroney, how rampant of an issue is this, and what can Congress do to help support the Trump administration protecting this program so treatment is given where it is needed?
Welcome back to America First, the channel where we cut to the political nonsense and give you the truth about what's happening to our great nation. I'm your host, and if this is your first time here, make sure to hit that like button and subscribe because we're bringing you the hard-hitting analysis the mainstream media won't touch. Ring that notification bell too, because YouTube loves to suppress channels like ours that tell the truth. Today, we're breaking down a congressional hearing on Medicare Advantage that reveals everything wrong with how our government handles health care and wastes your tax dollars. Let's dive in.
Excellent question. Full transparency, making sure that organizations, if there is abuse that's going on at an individual organizational level, that organization is being held accountable. Seniors in today's environment, they utilize these programs because they are of value. There's an additional $200 per member per month in benefits that are available and accessible to these individuals, which equates to close to $2,500 or $2,400 a year. And then when you think about if they had to go on Medicare fee-for-service on its own and they're selecting a fee-for-service program, then that program is anywhere from $200 to $300 per member per month, in addition to just to get the full comprehension of the program as a whole. I do believe that there is reform that is required. There's opportunity. There's opportunity for us all to sit at the table and to come up with a collaborative dialogue to make sure that how do we have full transparency and perfection to improve the program, but not take away from the program, and to make sure that the individuals that I've talked about, that they're still getting the value of that benefit on a monthly basis, in addition, not having to pay hundreds of dollars of premiums when many individuals who are enrolled in these programs are on very fixed incomes. Thank you.
So one of the well-known benefits of engaging the private sector is the faster pace of innovation, which in the case of healthcare means a system that can respond more quickly to the needs of patients and providers. My number one priority when it comes to healthcare reform is expanding access to higher quality care in rural communities. Dr. Bazel, we have seen rapid growth of MA in rural areas in recent years. What are some of the main lessons you've learned from your experience serving rural communities, and how should MA incorporate those lessons to enhance access and deliver better health outcomes for rural patients?
Thank you, Chairman. So one of the potential benefits of being an MA plan is that innovation and that flexibility to be able to respond to the needs, especially in our rural areas, our community health needs assessments that the hospitals do every couple of years. Transportation is a good example of something that comes up in the top 2 or 3 needs in those assessments in every one of our communities. Especially in our rural areas, there are not such things as ride-sharing programs or even taxi services, and a lot of times our hospitals are where that ends up taking on both the medical transportation, but even the non-medical transportation. Getting someone to social activities, loneliness, social isolation is one of the biggest predictors of adverse health in the elderly. And so that's a good example of where it's worth it to us to look at that transportation and to bear some of the cost of developing those programs, even though that's not a traditional healthcare expense. And so it's that type of innovation that the promise of MA hopefully can deliver on.
Thank you. In addition to the upcoding issues, we have heard about the MA plans, excessive pre-approvals can get in the way of timely care for patients and layer on additional paperwork for providers. In our rural communities, 80% of providers say utilization management creates administrative burdens. Dr. Miller, can you shed some light on how practices like excessive prior authorization have become a growing problem, and what can be done to improve care for patients and reduce burdens on providers while still maintaining the goal of a more efficient, lower-cost healthcare system?
I think everyone has a stake in this one. First of all, it should be one-click submission of data in the electronic health record. The patient's seeing you, you shouldn't get a request weeks or months later. It should be real time. You submit your data, it automatically ports labs, notes, imaging studies. You should be able to access what the medical criteria are. For outpatient prescription drugs, for example, you should know whether it's non-formulary, tier 1, tier 2, tier 3. So pushing that information to the point of care is something that CMS and plans can do together. I think on the provider side, we need to improve our documentation enormously. So a lot of denials are because you don't have the right information, you don't have the member number, you don't have the date of birth. The note is copy forwarded for every single day of the 24-day hospitalization and says the exact same thing with no additions. A lot of tools that we can do to support doctors and hospitals with documentation, the ambient AI scribes, the voice dictation. I think a lot of those things that will happen over the next 5 years from both the hospital industry, the plan industry, and CMS as a regulator can actually solve a lot of these problems. It's very fixable.
Thank you. Thank you, Chairman Buchanan. Chairman Schweikert, I yield back.
So I just watched this congressional hearing on Medicare Advantage, and folks, what I'm seeing here is both encouraging and absolutely infuriating at the same time. Let me break this down for you because this affects every single American family. First, the good news. We're hearing that 54% of Medicare beneficiaries are choosing Medicare Advantage plans over traditional government-run Medicare. Why? Because private sector competition works, people, when you let the free market operate. When you give seniors actual choices, instead of forcing them into a one-size-fits-all government program, they choose the better option every single time. These Medicare Advantage plans are saving seniors real money. We're talking about $200 per member per month in additional benefits. That's nearly $2,500 a year back in the pockets of our senior citizens who built this country. Meanwhile, if they stick with traditional Medicare, they're looking at paying $200 to $300 more per month in premiums. This is exactly what conservatives have been saying for decades. Private sector efficiency beats government bureaucracy every time. But here's where I get fired up, and you should too. The same hearing reveals that Medicare Advantage plans are defrauding the American taxpayer to the tune of $40 billion in 2025 alone. $40 billion of your money, stolen to what they call upcoding, where these plans inflate how sick patients are get higher reimbursements from the government. This is corporate welfare at its worst. Folks, these companies are stealing from hardworking American taxpayers, while seniors on fixed income struggle to afford their medications. This is exactly the kind of swamp behavior that President Trump promised to drain, and it's exactly why we need strong conservative leadership to hold these corrupt actors accountable. Now, let me tell you what really gets my blood boiling. We've got 80% of healthcare providers saying that excessive prior authorizations are creating administrative nightmares. Think about this. You're a doctor trying to treat a patient, and some bureaucrat at an insurance company who's never met your patient is telling you what treatment you can and cannot provide. This is rationing healthcare. Plain and simple. Our rural communities are getting hit the hardest. These are the backbone communities of America, the places where our food is grown and our values are strongest, and they're being left behind by a healthcare system that prioritizes urban centers and corporate profits over the Americans who need care the most. But here's what gives me hope. The witnesses in this hearing talked about real solutions. They want transparency. They want accountability. They want to use technology to cut through the red tape and get care to patients faster. This is common sense conservatism in action. When they talk about transportation services for rural seniors, that's not big government overreach. That's recognizing that our elderly Americans in small-town America deserve the same access to care as someone living in Manhattan. When they talk about addressing social isolation among seniors, that's understanding that strong communities and human connections are fundamental to health and happiness. The real solution here isn't more government control. It's not single-payer health care or Medicare for all or any of these socialist schemes the left keeps pushing. The solution is what it's always been: more competition, more transparency, and more accountability. We need to prosecute the companies that are defrauding taxpayers. We need to streamline prior authorization so doctors can focus on treating patients instead of fighting insurance bureaucrats. We need to support the Medicare Advantage program because it's working for seniors, but we need to clean up the fraud and abuse. This is exactly the kind of issue where President Trump's business background and his commitment to draining the swamp could make a real difference. He understands how to negotiate with corporate America, how to demand results, and how to put America first in every deal. What frustrates me most is that the solutions are right there in front of us. Use technology to make prior authorizations instant. Give doctors real-time access to formulary information so they know what medications are covered. Improve documentation with AI tools so there's no excuse for denials based on paperwork errors. But it requires political will. It requires leaders who will stand up to the insurance lobby and the hospital lobby and the pharmaceutical lobby and say, "We work for the American people, not for your corporate profits." Here's the bottom line: America First family. Medicare Advantage proves that conservative principles work. Private sector competition is saving seniors money and giving them better benefits than government-run health care ever could. But we cannot tolerate fraud and abuse of taxpayer dollars, no matter who's doing it. We need leaders who will fight for transparency, accountability, and results. We need to support our rural communities and our senior citizens who built this great nation. And we need to reject the socialist healthcare schemes that would destroy the progress we've already made. That's why elections matter. That's why your vote matters. That's why we have to stay engaged and keep fighting for America First policies at every level of government. If you found this analysis valuable, smash that like button, subscribe to the channel, and share this video with everyone you know. The mainstream media won't tell you these truths, so it's up to us to spread the word. Leave me a comment below and let me know what you think about Medicare Advantage and how we can fix our healthcare system. Until next time, this is America First, reminding you to keep fighting for our great nation. God bless you, and God bless America.